Welcome to today's Medicare 360 show. I'm your host, Jennifer Lee, and we are diving in the Medicare New Handbook on page 100. So let us just go back to how do I get help filing an appeal and how do I ask for coverage determination or exception? Okay. So, you or your prescriber must contact your plan to ask for a coverage determination or an exception. If your network pharmacy can't fill a prescription, the pharmacist will give you notice that explains how to contact your Medicare drug plan so you can make your request. If the pharmacy doesn't give you this notice, ask for a copy. Really, I haven't seen any pharmacists do this because every time the client, if it's not covered, they call us and they never say anything about the pharmacist giving them anything. So if you're asking for a prescription you haven't gotten yet, you or your prescriber may make a standard request or an expedited fast request by phone or in writing. If you're asking to get paid back for prescription drugs you already bought, your plan can require you or your prescriber to make the standard request in writing. You or your prescriber can call or write your plan for an expedited fast request. Your request will be expedited if you haven't gotten the prescription and your plan determines or your prescriber tells your plan that your life or health may be at risk by waiting. So important if you're requesting an exception, your prescriber must provide a statement explaining the medical reason why your plan should approve the exception. Okay, so there was one time where I had a client that really needed the prescription drug, but there was time for getting that exception or an approval, and he just needed it right away. So he was willing to pay for it out of his pocket and then definitely see if you could just get reimbursed by it by an insurance company. So every insurance company has different ways of getting that approval or that exception. Maybe most of the time you could just call in, but if needed, there might be like a form that you need to complete. So contact your insurance company for the different options on that. Okay, so what are my rights if I think my services are ending too soon? So that definitely does happen. Okay, so if you're getting Medicare services from a hospital, skilled nursing facility, home health agency, comprehensive outpatient rehabilitation facility, or hospice, and you think your Medicare covered services are ending too soon or you're being discharged too soon, you could ask for appeal, also known as an immediate appeal or an expedited appeal. Your provider will give you a notice before your services end telling you how to ask for a fast appeal. Read this notice carefully. If you don't get this notice, ask for it. With a fast appeal, an independent reviewer called a Beneficiary and Family Centered Care Quality Improvement Organization, BFCC QI0IO, will decide if your covered services should continue. You can contact your BFCC QIO for help with filing an appeal. Go to page 112. Generally, a fast appeal only covers the decision to end services or discharge you from the hospital. You may start a separate appeal for any items or services you may have gotten after the decision to end services. Visit medicare.gov/appeals or medicare.gov/publications to review the booklet Medicare Appeals. There are some exceptions detailed in the box below. Starting on February 14, 2025, you'll have the right to ask for a fast appeal while you're still in the hospital. If you're admitted to the hospital as an inpatient and hospital, change your status to outpatient getting observation services. For more information, visit medicare.gov/providers-service/claims-appeals-complaints/appeals/fast-appeals. I mean, I know hospitals seem to want to discharge you right away, maybe because of the costs or so forth. So please, if you do have and know when your end of service is, and you really definitely want to stay at the hospital and so forth, you need to file this ASAP, right? And it's the immediate or expedited appeal, because by the time, um, if it's just a regular appeal, you're going to be out. So definitely keep that in mind. I've had clients in this type of situation. So you definitely want to make sure that you could stay at the hospital if needed. Okay, so let's go over what else should we do? Okay, what's an advanced beneficiary notice of non-coverage ABN? If you have original Medicare, your doctor or healthcare provider or supplier may give you written notice if they think Medicare won't pay for the items or services you'll get. This notice is called an Advanced Beneficiary Notice of Non-Coverage, or ABN. The ABN lists the items or services that your provider expects Medicare won't pay for, along with an estimate of the cost for the items and services and reasons why Medicare may not pay. What happens if I get this notice? You'll be asked to choose whether to get the items or services listed on the notice. You choose to get the items or services listed on the notice you're agreeing to pay if Medicare doesn't. You'll be asked to sign the notice to say that you've read and understood it. Doctors, other healthcare providers, and suppliers don't have to, but still may give you a notice for services that Medicare never covers. Go to page 55. At ABN isn't an official denial of coverage by Medicare. If Medicare denies payment, you could still file an appeal once you get the Medicare Summary Notice, MSN, showing the item or service in question. However, you have to pay for the items or services if Medicare decides that the items or services aren't covered and no other insurer is responsible for payment. Can I get a notice like this for other reasons? You may get a skilled nursing facility ABN when the facility believes Medicare will no longer cover your stay or any other items and services. What if I didn't get this notice? If your provider was required to give you this notice but didn't, in most cases, your provider must give you a refund for what you paid for the item or service. Okay? Yeah, keep that in mind. Where can I get more information? Visit medicare.gov/basic/your Medicare-rights/your protections to learn more about the different types of ABNs and what to do if you get one. Note, if you're in a Medicare Advantage plan, you have the right to ask the plan in advance if it covers a certain service, drug, or supply. Contact your plan to request and submit a pre-service request for an organization determination. The plan denies your request, the response will include instructions to file a timely appeal. You may also get plan directed care. This is when a plan provider refers you for a service or to a provider outside the network without getting an organization determination in advance. Go to page 66. Okay, your right to access your personal health information. By law, you or your legal representative generally have the right to review and or get copies of your personal health information from healthcare providers who treat you and bill Medicare for your care. If you want Medicare to give your personal information to someone else, like a caregiver, go to page 107 to learn more about completing an authorization to disclose personal health information form. You also generally have the right to get this information from health plans that pay for your care, including Medicare. These type of personal health information include claims and billing records, information related to your enrollment in health plans, including Medicare, medical and case management records, other records that doctors or health plans use to make decisions about you. Generally, you could get your information on paper or electronically if your providers or plans store your information electronically. Excuse me. They generally must give you electronic copies if you ask for them. You have the right to get your information in a timely manner, but it may take up to 30 days to get a response. If your information is electronic, you may also request to have it sent to a third party of your choosing, like a healthcare provider who treats you, a family member, or a researcher. Okay. You may have to fill out a form to request copies of information and pay a fee. This fee typically can be more than the total cost of labor for copying the information requested, supplies for creating the copy, postage if you ask your healthcare provider to mail you a copy. In most cases, you won't be charged for reviewing, searching, downloading, or sending your information through an electronic portal. For information, visit hss.gov/HIPAA for individual/guidance materials for consumers. You need help getting and use your health records. Office of the National Coordinator for Health Information Technology, ONC, in the U.S. Department of Health and Human Services, HSS, created the Guide to Getting and Using Your Health Records. Shows you how you get your health records and make sure they're accurate and complete so you get the most out of your health care. Visit healthit.gov/how to get oh my gosh, to get your health record to review the guide. How does Medicare use my personal information? Medicare protects the privacy of your health information. The next 3 pages describe how Medicare may be used and give out your information, explain how you could get this information. Notice of Privacy Practices for Original Medicare. This notice describes how medical information about how you may be used and disclose how you could get access to this information. Please review it carefully. The law requires Medicare to protect the privacy of your personal medical information. It also requires us to give you this notice so you know how we may use and share disclosed medical information we have about you. We must provide your information to someone you name, designate, or someone who has a legal right to act for you, your personal representative. The Secretary of the Department of Health and Human Services, if necessary. Anyone else that the law requires to have it. We have the right to use and provide your information to pay for your health care and to operate Medicare. For example, Medicare administrative contracts use your personal information to pay for or deny your claims, collect your premiums, share your benefit payment with your other insurers, or prepare your Medicare summary notice. We may use your information to provide you with customer service, resolve complaints you have, contact you about research studies, and make sure you get quality care. We may use or share your information under these limited circumstances. Okay, let's read this. To state and other federal agencies that have the legal rights to get Medicare data like to make sure Medicare is making proper payments and to help federal/state Medicaid programs. For public health activities like reporting disease outbreaks. For government healthcare oversight activities like investigating fraud and abuse. For judicial and administrative proceedings like responding to a court order. For law enforcement purposes like providing limited information to find a missing person. For research studies that meet all privacy law requirements like research to provide a disease or disability. To avoid a serious and imminent threat to health or safety. To contact you about new or changed Medicare benefits. To create a collection of information that no one can trace to you. To healthcare providers and their business associates for care coordination and quality improvement purposes like participation in accountable care organization. We don't sell or use and share your information to tell you about health products or services, marketing. We must have your written permission and authorization to use or share your information for any purpose that isn't described in this notice. You may take back or revoke your written permission at any time unless you already shared information because you gave us a permission. You have the right to review and get a copy of information we have about you. Have us change your information if you think it's wrong or incomplete and we agree. If we disagree, you may have your statement of your disagreement added to your information. Get a list of people who get your information from us. The listing law won't cover information that we gave to you, your personal representative or law enforcement, or information that we use to pay for your care or our operations. ask us to communicate with you in different manner or at a different place, for example, by sending materials to a PO box instead of your home address. Ask us to limit how we use your information and how we give it out to pay claims and run Medicare. You may not be able to agree to your request. Get a letter that tells you about the likely risk to privacy of your information, breach notification. Get a separate paper copy of this notice. Speak to a customer service representative about our privacy notice, 1-800-Medicare, which is 800-643-42227. If you believe your privacy rights have been violated, you may file a privacy complaint with the Centers for Medicare and Medicaid CMS. Visit Medicare.gov or call 1-800-Medicare. The U.S. Department of Health and Human Services, HS, Office for Civil Rights, OCR, hs.gov/HIPAA filing-a complaint. Filing a complaint won't affect your coverage under Medicare. The law requires us to follow the terms in this notice. We have the right to change the way we use or share your information. If we make a change, we'll mail you notice within 60 days of the change. The notice of privacy practices for original Medicare became effective September 23rd, 2013. How can I protect myself from fraud and medical identity theft? Okay. Medical identity theft is when someone steals or uses your personal information like your name, social security number, or Medicare number to submit fraudulent claims to Medicare and other health insurance companies without your permission. When you get healthcare services, record the dates on the calendar and save the receipts and statements you get from providers to check for mistakes. If you think there's an error or a provider bill you or your services you didn't get, take steps to find out that was billed. Check your Medicare summary notice, MSN, if you have original Medicare to find out if the service was billed to Medicare. If you're in Medicare health plan, check the statements you get from your plan. Log into or create a secure Medicare account at Medicare.gov to review your Medicare claims if you have original Medicare. Your claims are generally available online within 24 hours after processing. You could also download your claims data from your Medicare.gov account by going to download my claims and personal data. Under my account, you could also call 1-800-Medicare, 800-633-4227. If you know the healthcare provider supplier, call and ask for an itemized statement. They should give this to you within 30 days. Okay, that was a lot. And so this is one of the reasons for fraud or medical identity theft. The reason why I got into Medicare was because started seeing that my father-in-law was receiving bills. It was showing $5,000 that someone was claiming, a doctor was claiming on his Medicare. And I had no idea, no clue on how Medicare worked. And I'm like, I'm licensed in life and health. Why don't I know these things? So I went down that rabbit hole and come to find out that he was put on hospice. And the only reason why I found out about it was one day he couldn't get up from bed. And I'm not a nurse. Yes, I offer healthcare insurance, but I had no idea. But he did have a mild stroke. And when that happened, I was reviewing his files, come to find out that he was on hospice. Because on this folder it was like, don't resuscitate him, don't call 911, don't go to the hospital. And like, seriously, like, of course we want to resuscitate him or take him to the hospital if need be. So finding that out, I was still clueless and so forth. But I did talk to people in the industry on how all this works. And unfortunately, my in-laws are just not the type to call for fraud and so forth, and they didn't want to press charges or do anything else with this because um, it was their trusted friend that was, I guess, helping them with all this. And as a daughter-in-law, as a daughter um, or son, definitely, I would say if your parents, your elderly start making you friends, like, why are these people helping them? What's the reason for it? Um, right? Because you never know the ulterior motives of these people. And come to find out, um, I think that was the demise of my father-in-law's health, and so forth. But that definitely is a topic that I'd probably want to talk to in the future. But just really want to make people aware that fraud does go on, and for people that may not know the rules and the laws, or um, are just not born here, or minorities, they definitely are targeted more heavily, I would believe, and just not really educated on the healthcare systems and so forth. So, that was a little bit of a downer. Um, Miss my father-in-law, but that's definitely a story. But he definitely has got me the passion to learn about how Medicare works and the abuse and fraud that goes into it. Okay, so I mean, if you've contacted the provider and you suspect that Medicare is being charged or for a service or supply you didn't get, or you don't know the provider of the claim, call 1-800-Medicare. You could also call 1-800-Medicare if you believe your Medicare number has been used fraudulently. And that could happen too. Definitely. Some people don't know that they have services. Um, they just don't only give information like your Medicare number to doctors, insurance companies, and their licensed agents or brokers or plans acting on your behalf, or trusted people in the community who work with Medicare, like your state health insurance assistance program. Don't share your Medicare number or their personal information with any unsolicited person. Contacts you by phone, email, Medicare, or your medical representative will only call you in limited situations. So definitely, do not give your Medicare information to just anyone on the phone. They typically will change your plan, bill you up some services or products that you don't even need or know about. Medicare plan can call you if you're already a member of plan. The agent who have helped you join also could call you. Customer service representative from 800 Medicare can call you if you left a message, or representative that someone called you would call back. You find yourself, if you filed a report of suspected fraud, you get a call from someone representing Medicare to follow up on the status of your suspected fraud report. For more information about Medicare fraud, visit medicare.gov/fraud, or contact your local senior medical patrol. Learn more about the senior Medicare patrol and help find your state by going to smpresource.org or call 877-808-2468. So thank you for listening today. My name is Jennifer Lee, your Medicare 360 host. I look forward to talking to you guys next week. Have a wonderful day.